How are you? We are continuing our fact versus myth series because some of my things that I hear on a regular basis, feedback from both the website, from patients, and what we're talking about is hormones. Because the myth is that hormones have nothing to do with skin. The fact is that hormones are a huge part of what goes on with your skin, and in men, and in women, and in young people, starting from the time their hormones start to rise until your hormones go away, in which case they need to be treated, because as I say to people, when you get ready to die is when you quit treating your hormones, okay? You quit thinking about your hormones because they have to do with your bones, your brain, your immune system, everything. Never mind, fact, hormones are essential to be balanced for your skin to be good, okay? Whether it be tightness, whether it be collagen production, whether it be mood, whether it be stressed, whether it be PMS, whether it be erections, whether it be orgasms, whether it be acne, blackheads, enlarged pores. Hormones are an essential part to be balanced for you to have good skin. So, hormones, as they start to rise in men and in women, when you go through puberty, that's when you start to see blackheads. You see the skin get oilier. Okay, now, if you're stressed, if you, well, in particular, you're stressed, if you're inflamed, your gut's inflamed, what that does is it makes you oilier, it makes you more inflamed, and that's when you start to see people get back acne, chest acne, blackheads, and then blackheads become pimples, spots as the Brits call them. We love that. And sounds so much nicer. And so you have got to have your hormones balanced. You've got to treat the outside of the skin. You've got to treat the inside of the skin. So I see a lot of, young teens come in. Their parents at first will call me and say, oh, my daughter or son is starting to get blackheads. One of the things that I use first and foremost for that is exfoliating repair, repair and exfoliant with some of the professionals, because it helps go in and get rid of the blackheads, dissolve them, get rid of them. And even in look, I see older ladies and men who have blackheads in their nose. Why is that? They're inflamed internally. They're not exfoliating their skin. And when they're inflamed internally, their DHEA, which is a hormone that comes out of your adrenal glands, is usually increased, and you get these little blackheads, okay? Look, you can have thin, not oily skin and not have the acne gene like I do, and you still get blackheads because when you're stressed out, your testosterone is higher, and also some women and men, well, some women in particular, are what's called testosterone dominant, which means that they're the go get the job done. They should be the CEO of the company. They tend to get more blackheads when they're in their 20s, their 30s, their 40s. Then their testosterone starts to go downhill. Their DHEA, which comes out of their adrenals, is higher. Blackheads, get some pimples. If I'm treating people's hormones, one of the symptoms, if I give them too much DHEA, they'll get one little pimple. So the skin is a window to what's going on the inside. Very important to remember that. Now, young ladies in particular who don't start their period till later, their hormones are low. Their thyroid is generally low. And remember, thyroid, adrenal glands that sit on top of the kidneys, estrogen, progesterone, estriol, testosterone, DHEA, those are all hormones that men and women have They're just in different amounts. So young women who don't start their period, you have to look at their thyroid. That's a hormone. And if your thyroid is low, your skin, you sort of look swollen. I look at pictures sometimes of people and I go, oh, their thyroid is low, because they're all sort of swollen. Their eyes are sort of swollen. Their eyes are sort of closing up. Thyroid, adrenals. You wake up in the morning, you're exhausted. Your adrenals are low. And when your adrenals are low, your skin doesn't make new collagen as well. You start to look older. You start to have pigment that builds up in your skin, melasma. All those things are hormones impacting skin. The skin is a window to what's going on the inside. So, in young men, I get young men who come in who at 20-something, maybe their thyroid's low, maybe they're all stressed out, their adrenals are low, their testosterone is low. Maybe they don't get an erection, okay? They don't want to tell you about that, but maybe they don't. And with their skin, they start to look older, okay? As people, and with men as well, they've got to treat their skin equally, but hormones play an essential role. Your bones, part of aging is that your bones dissolve. That's part of what makes your skin fall. It's why you care about progesterone. Men, as they get older, get sometimes hard to live with. Why? I look at their progesterone blood levels. Their progesterone is low. All of that, you can look at the skin often and tell what's going on with hormones. Now, as women start to go through menopause, nowadays, people are all worried about being perimenopause or whatever. What matters most about that? Number one is not being inflamed. Internally, you are what you eat, exercising, because that helps your thyroid be better, helps your skin be better, helps you slow down the clock and turn back the clock, putting out the fire, taking the things you need to take internally. Look, vitamin D essential, glutathione is essential, vitamin C essential, but those impact your hormones, okay? If internally you're depleted and inflamed, it makes your body less likely to make a normal amount of hormones. As you go through getting closer to menopause, what's the first thing I look at? Is the thyroid, the most imperative foundational hormone, along with adrenals, another foundational hormone. You make sure those are good, because I have people who stop having a period, they come in, I treat their thyroid and adrenals if they need treating, which they generally do. Everybody needs their adrenals treated in today's world. They start looking better. Their skin gets better. Their skin color gets better. They look younger. Then the skin products I put on the surface of the skin work better as well. But their skin gets drier because their hormones are lower. So hormones are an essential piece of this puzzle. It's all on the website about, what hormones to treat and how to treat them. But very important is to understand fact. Hormones are essential to be balanced, just like your antioxidants, your food, your exercise, your mood, doing the right skin products. Myth is that they do not play a role. They play an equal role in men and in women.
Symptoms on our website also.
Symptoms, my second brain tells me, thank goodness for that, is that it's all on the website. So hopefully this helps you, because I'm trying to dispel the myths and to make people understand science and not marketing and not misinformation and propaganda that people are fed. Thank you. Thank you.